Hey friends, welcome back to Blushing Phoenix. My name is April, and you are in for a treat today because on the channel today we have an interview with Dr. Justin Deering, who practices functional neurology and chiropractor and acupuncture and concussion care and movement stuff. Those are my technical terms for all the things that he does. But I will let him share more about himself, and I'll also put his information in the description box below. But today he's going to be talking to us about blushing and flushing and overactive nervous system, and also how functional neurology, chiropractic care, and acupuncture, breathing techniques, and all these grand things can help us navigate our journeys with skin flushing. And he tells so much great information that I assure you, you're going to need a pen and paper, or you're going to need to listen to this like 14 million times. And I don't mind if you do, because it helps other people know we're out there. And speaking of that, while I've got you here, would you go ahead and hit that like button and subscribe to the channel and leave a comment below about what was most helpful to you with what he shares? Or have you seen a chiropractor before, or an acupuncturist, or a functional neurologist in regards to your blushing or flushing experience? So without further ado, Dr. Justin Deering, ladies and gentlemen. So I have to tell you that Tony was just up here a while ago, and I was freaking out, and he goes, "What is wrong with you?" And I go, "I'm about to interview Dr. Deering, and I'm super nervous." He goes, "You're nervous?" And I go, "Do you realize I usually have Dr. Deering for this long, and I ask him 14,000 questions during that time? I'm actually going to have him with questions." And when I was trying to map these out, usually I have one page of questions for people. We may ask them, we may not ask them, depending on how the conversation goes. I would write a question for you, and then it would spark 14,000 other questions. And then those 14,000 questions would spark other questions, because you know all the things. And then
that's my entire career. That's how we got here with 14,000 question marks.
It did. So I was thinking, all right, how do I anchor this and center it so that I can get the best responses and the best time with you? So I guess the main topic that I think we should anchor to, and obviously this is your expertise, is overactive nervous system. And there's so many different things that can fall in line with that. So I guess just to start off, can you explain what is functional neurology in human terms, and why is that beneficial?
Human terms. So functional neurology is basically the amalgam of all the clinical therapeutic strategies that we've ever seen applied to movement problems of any sort, whether that's back pain or whether that's brain injury. The assessment and the application is and has always been of a functional characteristic. How do we get somebody's function back? And that is seen in Chinese medicine. And so to draw those parallels of that most ancient medicine to today's clinical understanding, what we know about neurology and brain injury and all of those things, it is a functional approach to help the nervous system do what it's supposed to be able to do without all the convoluted compensation that our brain puts onto our body. And we'll talk, maybe if you want to go down that road, about the about the evolution of the human stance and walking and bipedalism and the whole way that we came to be this way. It can only be understood through an evolutionary lens and what it means to have a frontal lobe, an executive function center, and an overactive nervous system. Like, we're born to be anxious, and so anxiety's kept us alive. So it's like a really good thing to have. And so you get these particular responses, like like you were talking about here with your blushing phoenix. I wondered if that was a real diagnosis, and so I went and I searched it, and I said, "Is that what it's called?" And I was like, "No, that's just a very clever name. I like that. That's
who we
awesome."
are. Yeah.
Right.
One of the things that I found through when I told you, I said, "Hey, I started recording myself talk about this because it's been a secret to me. Wear high neck shirts, don't let anybody see it, so that they think I'm nervous or I'm weak, or there's this image of me that will be demolished because they will see me flushing." Because people assume you're anxious, you're upset, there's something going on with you right now, you're afraid. And when I started talking openly about it just on YouTube to nobody, people started finding it. And there have been people from all across the world. I just got a message yesterday from somebody from South Africa that was like, thank you so much for talking about this. And you were one of the first people that I walked into your office and I was like, what is this? And your response was, just your blood vessels. And you carry on with our appointment. And I noticed that with my relationship with you, a lot of times I'll come in and say, you'll say, where's the pain? I'll say, on my bad side. And you go, there is no bad side. And you try to help me think differently about how I'm seeing. So I wanted to ask you, one of my questions here was, when I do that, I'm dying or I'm doomed or this is happening, is that part of your approach to get me to think differently about what's happening?
Yes. I mean, anytime if you get anxious about anything, let's say you have a panic attack. You've had a panic attack or come close to it. I've had one. It was terrible. But when you get in that moment where either you have to perform really, really intensively, like maybe you're on the sport field or the battlefield or something, there's this story of the way that people experience that as my vision narrows and time slows down and I only see one thing and I'm hyperopic on the ability to see this thing that I have to do to survive or to whatever. So it's like your brain makes that happen, right? And it does that by impending doom or threat or chance of victory, or, all of those things are the same. But in the case of this happening, you walk into the office, you got a thing. What's this thing? I'm stuck on this thing and it's been killing me and I'm frustrated by it and it started to consume. And everybody has this experience, by the way, not just you or me or the 10 people I saw this morning.
Okay.
It is a very ubiquitous human experience to have this arousal type of feeling when something becomes prevalent in your experience. So if it's pain and you say, I've had this pain and it's just been sort of lingering and now it's getting a little bit worse, and you come in and you ask the question, why is this happening? Why is this happening to me? Why am I suffering with this? And so the approach, to answer your question, is to just flip it for a second, to think about it from a different angle, to say, what things are involved with this? How did it begin? What are you doing about it? How are you living with it? Obviously you're not living with it. You're here, you're struggling with it, and you want a solution. So then the best solution there is to ask the right question and to get you to think about the right question in a way that helps you reframe your experience just in that one moment. So by reframing something, you're obviously taking a different view, and you come at something from a different angle in any other aspect of life. You're like, oh, well, I finally figured that thing out when I sat it down for a week, that one little puzzle I was trying to solve.
Right.
I just quit looking at it for a week and I came back at it and I solved it. So it's the same thing when it's a treatment experience like that, or anything that you are experiencing that is nagging or troublesome. So
Gotcha. Yeah, because I noticed that as a theme in our relationship when I come in and and obviously I'm overly exaggerating with you because I know you know me and I'm like, everything's falling apart, help me. But you also, right. When I think back about the 7 years that I've been working closely with you, is that so much of that time has been you helping me see things from a different angle and helping me let things go. And one of the things I notice with people who blush or flush, whether it's a facial flushing situation or a chest neck flushing situation, are those the same thing? Is it just the blood vessel situation?
Yeah. So I dug in and did a little research for your talk here.
Good.
so that I could see, what's the literature on that. And one of the most helpful pieces was that when you have this flushing type of syndrome, it can happen in the face, it can happen in the cheeks, it can happen in the upper neck or the lower neck or the upper chest or all of it. And what they found in looking at what they call sympathectomies, where they go in and they cut a ganglia, which is a nerve root, which is associated with the most upper portion of our sympathetic nervous system. So if you've looked at this subject for any amount of time, the sympathetic versus parasympathetic nervous system. Fight or flight creates the flush, impending doom, anxious thing. And rest and digest is the parasympathetic nervous system, which is the calm. Oh, I can take a deep breath now. I'm out of that situation. I can return to normal, right? And it's that sigh that you notice almost every time if you have this anxious experience, even if it's a low level of anxiousness and you're walking into a meeting and you're commanding control of the meeting and you got it and you know everything you need to know, and there's no reason for you to be anxious or worried. It's just a situational deal, and you walk in and you flush, even though you're not really conceivably anxious in your own awareness. It's there, right? so that is this pure activation of that sympathetic nervous system. Basically, that study that I looked at, they had cut these nerves that come out of the neck, and the people who had those experiences completely resolved them, because it's the sympathetic chain that is at the very top of the thoracic spine and extends all the way down to the lower thoracic spine. That sympathetic chain communicates with the whole head from the base of the neck. And so it just so happens that in a situation like yours, you have the chest or lower neck flushing. That's where that sympathetic chain ganglia comes out and promotes dilation or constriction of blood vessels in and around that region. And that could go all the way up to the head. That could only be one branch where people flush only in the cheeks. That could be only one side. It flushes at the bottom of the chin. And so that comes from that sympathetic system. And so the research says that if you cut that nerve, then it doesn't happen anymore. Yeah. But that's ridiculous, because you need that nerve for lots of other things. So don't do that.
That's well, I actually just interviewed someone who had the ETS surgery. She had facial flushing, chest flushing, like it was like all of it, arms and everything. And she considered it successful for herself. It stopped the facial blushing from happening, but she still gets splotches on her neck. And it was I believe a doctor in Austin, Texas, maybe. I could be saying that wrong, but it was somebody who actually has studied it. But after working with you, I always tell people from the channel, if they're considering it, speak to whoever they need to speak to about it. But I personally don't consider it, because if I work with you and you've taught me a lot about how my body functions, I felt like if I cut nerves or singe nerves, it's probably got something more to do than just me turning red. It's probably got some other things that it's attached to, and it's not really something that no judgment. I'm just not up for it myself, but
sure. But if you don't have to cut nerves, then it's not a good thing to do necessarily, unless it's just completely debilitating. Then there's certainly times and places where it's necessary. But in a world like ours, you feel judged by this thing, but trust me, those people that you might feel are judging you are certainly thinking about them own selves and their judgment of themselves. So
I think that there's like, I read a story about a guy who did commit suicide over it. And people suffer alone with it. And I think that's why when I told you about it, because you know a lot of things about me, and I'm like, what is this? Help me understand it. I felt like if I could better understand it, then either we could try to get rid of it, or at least maybe understanding it would make me get to a place of acceptance with it, because it wasn't always there. It started to come, as I got older in life. But I definitely think talking about it to you helped relieve it just a little bit. And so when I started publicly talking about it on my channel, where there's no personal people associated with this channel. This is nobody personally, besides a few people that know me closely, know about this channel, because I talk about some of the things that I've shared with you about my work experience and the fears of fight or flight inside of my work, and somebody with authority who is over me. Even if I trust them, essentially, my body does not trust them. And so I can have a conversation with my boss and I'll be completely flushed, even if it's a great conversation and a trusted conversation. It's just something in me knows, and with my history, that he could fire me at any moment if he wants to. And I have to perform for his approval to continue to stay in that place of approval. So that's there. And then we throw in there too, erythrophobia, which is the fear of blushing. So kind of going back to what you were saying earlier about helping me change my focus and my perception and perspective on things, is that then it kicks into, I don't want to blush or flush. So now I'm going to, because whether I'm thinking about it outright or not, I'm thinking about it.
Right.
So that's wild.
So that's the mind bender that we always get into, is that we can perseverate something in our own mind because it has always helped us with survival, to be constantly focused on something until it resolves. So that's completely normal. But if something is happening automatically like that, it can be, it can be a different scenario. So I always like to take things and say, this is a particular scenario that you're familiar with, that you've experienced. But let me tell you a story of another patient, right? Similar scenario, except for instead of getting anxious and flushing, they get anxious and they get super dizzy, right? And they're lightheaded and they feel like they're going to pass out. I can't look up without feeling like I'm going to pass out. So I get anxious about anything that's over my head because I have to look up at it. And anytime I perceive anything over my head, which is inside a building or whatever, I get anxious and dizzy without even actually doing the thing that makes me dizzy. I get anxious about having to do the thing, and that creates my symptoms. So it's this wild thing that our brain can create that. And that is a very primitive, fundamental mechanism of how we stay safe. And so if you look at it and say, well, why don't I feel safe? Well, for all those reasons you listed, that is deep within your history and your memory, and you're really tied to that. And that's okay too. So how would one conceptually put together a plan to come to grow out of that, or to not even grow? There's nothing wrong with it, but how do you develop something so that you can dampen that response so that it doesn't affect you in public? Recently, we've been doing a lot with looking at folks with anxiety, because there's a lot of them right now with COVID, and it's creating all kinds of stuff. So we have been diving into some of the psychological components of treatment a little bit more so than I had in the past. And so breathing and vision seem to be at the top of the literature at the moment. So there are some good folks out of Harvard and one really interesting neurobiologist at Stanford is Andrew Huberman. And you can look up this particular article that I was kind of reading and applying to your scenario so we could talk about it. And this article is called "Vision and Breathing May Be the Secrets to Surviving 2020." Put it in the current context. But he talks about how breathing can change your heart rate. We know that. But how do you apply that in a situation where you're anxious? Okay, well, it always helps to take a deep breath and exhale for longer than you inhale, because you can physically, consciously slow down your heart rate, which is normally an automatic thing. So if you get blushed and you're flushing, then you probably also have an accompanying heart rate that's beating a little bit faster. You have a little bit of sweatiness on the palms that's more than usual. Several other sympathetic things that come along with that symptom. So if you can't physically control the blushing, if you can't physically control the sweating of the palm, what can you control? Well, you can control your heart rate, and you can do that by breathing. Okay, well, you can't do that kind of breathing if you're in the middle of a meeting, right? So the fact that he brought vision into it, which is something we work with a lot with brain injury and neurology and concussion, but I hadn't quite thought of it from this perspective, is that he's stating something that I've always known as well in a different aspect, is that if I go into a big room in a conference and I go to speak to people, I get the same exact symptom that you get, except for maybe I don't blush, right? But my heart rate goes. It doesn't matter how cold I know the subject. It's just the matter of the fact of you're up there and you don't know who's watching you or judging you or whatever, that deep thing that's in your memory of like whatever inferiority or lack of safety or whatever it is. You go out and you go present on this topic, and if I lock eyes with somebody that I'm speaking with in this crowd of 20 or 100 people, then it always triggers that symptom. No matter if I get into it and I'm feeling good and the initial butterflies have kind of gone away, if I catch somebody's interest and my vision catches their vision, it's like looking at the eyes makes it go, It's like, oh man, they just saw in my soul or something,
Right.
They found me out. I'm a fake, but that's this deep feeling. And so his suggestion is that, let's say that you are having a panic attack, or you feel extra nauseous and you're going to throw up on the boat. What do? You look at the horizon and you you change your gaze, you change your perspective, right? So you just look at it from a different angle. And so the technique in the lecture world is to look at the tops of people's heads, right? That's just a sea of people and not things that are judging you or going to prove you wrong or whatever. But to be able to look out and not make contact necessarily, you just sort of scan the crowd, and that helps to eventually calm the sympathetic nervous system that is just inherently activated at that point. But his point is that you look out at the horizon, you change your perspective, and just by looking out in the distance and not looking at any one thing in particular, and just kind of scanning and knowing your total environment that's immediately next to you, near your feet, but you're also looking at the distance at the same time, and you just take in this big wide picture, then your eyes have to dilate. So it's like a sympathetic discharge to be able to change your perspective and look out in the distance. Your pupils dilate, and it takes up some of that noradrenaline that you have stored in your brainstem, which is this activating system that goes to your sympathetic chain in your neck that makes it go. So it's like, how do we find releases in a different way?
Wow.
That doesn't require me to try to always hide it, you know? Like, you have another avenue of like a pressure valve relief. So for me, speaking, I look at the tops of people's heads. It changes it for me. I'm fine. But in an environment that you're speaking about, you're on a one-on-one conversation, you got to like make eye contact and all of that, you know, how do you change your focus? Well, maybe you don't focus on the eyes. Maybe you just sort of focus on the face in general, and you just let your eyes change perspective to take in the whole of the room while you're still making your point.
Wow.
Listening. So just thinking about things from something that you can control. One is breathing, and two is your gaze fixation.
Wow. See, and that's something I think that from the vision standpoint, it makes so much sense, because when I have sunglasses on, I feel safer. When I've noticed a lot of people, and myself included, when we're going out, if we have a mask on, you feel a little more calm with the mask on than we did when our whole face was out and about. Like, for a lot of people, it's going to a cash register. I'm talking to people from the channel. It blows my mind, because I just thought this was weird stuff that I made up. And they're like, no, it's something about being at the cash register, and they're, you know, waiting for your groceries to be done. Something about having a face mask on makes you feel safer there. And it's something, I guess, about the face, or maybe it has to do with the eyes as well, that just looking into somebody's face, or knowing somebody's looking into my face. But especially for the eyes, and in my career, we've been taught, if you don't look into the eyes, and it shows a sign of you're not confident and all these things. But yet at the same time, I feel like I'm dying on the inside when I'm looking into somebody's eyes.
Right. Yeah.
Doesn't make so much sense.
And, you know, that's a powerful thing. Your eyes basically are the brain. So you're looking at, you know, what people call the sunglasses, like soul blockers or something. You can't see my soul. But if you just try to change that perspective by looking at the bridge of the nose, you're still looking at the eyes, you know. And if you look at the bridge of the nose, then you're not like caught by this other person's eyeballs moving, and like you're entranced by that thing that you have to make contact with, and then you can't think because you're watching this thing happen.
And then you're wondering, what are they thinking? Their eyes are telling me they're judging me, and they're thinking about me.
Right. They just look to the right. They must be having a thought about me.
They don't like me. I'm not approved.
That's right. So look at the bridge of the nose. Take in the hair. Take in the surroundings in the background as you're looking at that nose, and just change your perspective and take a breath, a longer exhale. You know, as you're speaking, I use speaking when I'm bouncing from room to room all day to kind of calm me down, because I'm late for this person or whatever's going on. I just left a room where there was a lot of intensity or something, and I go into the next room, and I'm trying to calm myself down to match the person that I'm speaking with, and, you know, find out how I can help them. And so oftentimes I will just take a big deep breath and just start talking, and just keep going with the talking, and talk, because I'm exhaling as I'm talking. And that seem to sort of help me manage my tension and stress at that moment. And I've even looked at it on tracking apps and all of that stuff, and it seems to help when I pay attention to it. So.
Wow. I remember you told me one time, a couple of years ago, or a few years ago, I was constantly feeling like I was going to get a cold sore. And I told you, I was like, all day long, I can feel it, like it's about to happen. And you said, are you breathing? And I was like, well, yeah, I'm alive. And you go, I bet you're not breathing. And you taught me how to breathe properly. And the first time I took the real breath, it hurt because I didn't realize how shallow I was breathing. And I think from my history of that year of anxiety and panic and that crazy year that I had in 2011, and then it was a few years later when you were asking me, are you breathing? And you taught me how and told me to do it over the weekend. And that feeling of I'm constantly going to get a cold sore, it's so rare that that ever happens unless I'm in a very emotionally charged for days with lack of sleep, major, issue situation. But that was my life constantly, where I just felt like, oh, I need to get something because I feel like I'm gonna create a cold sore here, and I don't even know what's happening, but it's because I wasn't breathing.
Right. It creates this internal tension. So they say a lot of anxiety is caused because there's an impending panic, right? Panic, I can't get out of the situation. I'm stuck in a room, claustrophobia. I'm in this social situation. I'm panicking because I'm going to be judged, or I'm going to fail, or I'm going to be seen, or whatever. A lot of that is accompanied by a lack of breathing. So we get what they call tachypnea, and you pant, right? As opposed to taking a real breath. And being that that's the conscious thing that you can change in that moment, then we started finding that if you can just use that breath often throughout the day, then you can reduce significant amounts of stress in the overall system. So you can keep it from panicking because your brain knows that you have oxygen, and you can trip that switch to take a deep breath. And so it feels safer because it's not going to run out of air. Or, some people are dizzy and they become anxious just because they're dizzy. And as soon as we help them to feel not so dizzy by doing whatever technique is required, then the anxiety just melts, because that person was anxious because they felt like they were going to fall on their face. And that is a lack of safety too. Right. So if I can't breathe, I'm going to panic and flail in the water. If I'm potentially drowning, I'm not going to be able to breathe. I'm going to panic. Or if I'm dizzy and I feel like I'm going to fall, I'm going to be anxious all the time. So we just see it in many different ways, this overactivity of the sympathetic nervous system. And we try to apply things that would be helpful in that. And we've come across a lot of really important things over the years that I've actually put into our foundation protocol that is now kind of on an education portal. I think maybe we've talked about, which is the importance of breathing, and some of these traditional concepts from not only Chinese medicine, but Ayurvedic medicine and even osteopathic early medicine in the United States with osteopaths. Talked a lot about the chest and opening up the chest. And if you've been anxious or you've had a panic attack before, you feel this heaviness on your chest and you feel this clamping down sensation, and like you can't take a deep breath because of it. Well, that's a common experience in humans. And the thing that beats that is to get the neck open and to get the chest open, to be able to breathe and let the chest rise and the shoulders to come back and the head to sit on top of the shoulders, like we are supposed to, right? But when we're here on a phone all day long, we're promoting this chest compression and my head going forward. So just taking time every day to think about the foundational components of what it is to be upright and to have the chest open and to have the neck free, so that you can, have good vision. Chinese medicine developed these exercises for ophthalmology, for eye problems. And they saw that it was essential to have the chest open in order to get energy or blood flow or whatever to the eyes, so that they could have good vision, or they could move out disease or something like that. So just this concept of opening the chest has everything to do with the tension and the tone on this sympathetic chain ganglia in the base of your neck. So getting to a place where you can sort of meditate on your breath and really try to get to a place where you feel the most comfortable in a postural upright position. That's why you see the Buddha behind you with the plant. I mean, he's sitting upright, his shoulders are back, he's holding the pot, everything's good in the world. And because his spine is straight up and down with gravity, he's part of the earth, he's grounded.
Yeah.
They see anxiety and those things as windiness, like you're not grounded, and you're just floating around up there waiting for the next thing to hit you, and you're anxious and dizzy and whatever else. But Buddha, he's grounded because he's cultivated some technique, and he's got the ability to breathe well and to know his place, and he's safe, and he's looking out in the distance and he sees the surroundings, and he's got a good handle on things.
Yeah.
So I think that's very important for us to all understand, and to have a way that we can calibrate ourselves each day. And I think that we all need it all the time. I need it. I know this stuff and I apply it to patients, but do I always apply it to myself? No, until I feel the need, So you just work on developing those types of concepts in your everyday practice and build it into your daily routine. And I see that being very powerful in the folks that we apply that particular protocol to. So.
Right. I know that it's helped me tremendously just with the breathing. And I can always tell by the way I feel, if I feel dizziness or something like that going on, then I know when's the last time I breathed, and just take a moment to become aware of my hands, my body, where my feet are touching, and bring myself back to the moment and breathe. And I was going to say, because we were talking about increased heart rate, and I hadn't been able to actually see you in person since I went and saw a PA. I told you I was going to go see a PA, and we were going to talk about some of these things that were going on. And she actually was really fantastic and took a very psychological approach, even though that's not really her backdrop. It seems like that's touching everything nowadays, which is, I know you've helped me with a ton with anxiety, ADHD symptoms and things like that. But she did prescribe propranolol, a small dosage, and told me to test it out just to see. And I did. And I actually had great results out of it. Like the flushing, it wasn't so much, I couldn't figure out if it's because I wasn't actually flushing or I didn't care if I was flushing. It's like it took the fear of, am I about to flush away? There definitely were some side effects that weren't too bad if I needed them in a big setting.
Right. Yeah.
But I feel like it calmed me down. So, I'm crazy. So it calmed me down so much. And I was so focused that I almost didn't like it because it didn't feel like me. But I didn't feel numb or out of sorts. And I felt very bold in my meetings at work, where I kind of had to be very aware of, let's not say this out loud, because it took that edge off of that the fear that's there of, what are they going to think? What are they going to think? That was gone. And it was a small dose. It was 40 milligrams actually, which actually seemed like a little much. It was actually making me tired. So I went down to 20 milligrams, and it's just take as needed. So we tested it out. I know that it did help me feel better in that type of situation. But then there was another day where I guess it was a few hours later, it's like my system just overrode it. It was like, nope, we don't care about this. But I could tell it calmed my heart rate down. My heart rate goes just high all day long. And so with that said, what would you say, and this might be a loaded question for those of us who really are experiencing that overactive nervous system reaction, I guess in a way to condense it down, what would be triggering that? What are some symptoms we might be able to look for to say, I might be having an overactive nervous system reaction? Is it just the blushing itself, or is increased heart rate, some other things?
Yeah. So you almost always have a cue beforehand that something's going to happen. Probably if you're walking into a meeting, it's just the thought of the meeting. But oftentimes you'll have a sign. So sometimes for people, it's the sweaty palms that come up first, or you get this itchy feeling of discomfort through the body, or maybe it crawls over the skin or something. Or you just feel extra heated, or you feel your ears kind of flush a little bit. Those are things that will happen beforehand. But usually when a sympathetic sort of storm like that happens, it will turn into breathing difficulty if you notice it, depending on whether you're aware of your breathing or not. Oftentimes palpitations and heart fluttering, like or just increased heart rate in general can be part of it. So all of those sympathetic systems are going to be experienced differently by everybody. But finding a trigger is important. I would say that for most people that experience something to that degree are going to have multiple triggers, and finding all of them is one thing, but I also encourage people not to go around looking for the scary cat all day long and like being obsessed about finding that thing. I think it's more important to be aware of an internal cue and be able to do something with that internal cue. So I'll give you an exercise that I like to do, which came out of some psychologists who realized that mindfulness was better than cognitive behavioral therapy for lots of things, specifically anxiety. And one of my favorite exercises from the book was this idea of the hub and the wheel. So if you have a wheel, like the old wagon wheel with the spokes on it, and you have a hub in the center, you think of like observing yourself from this hub. So technically this is a mindfulness or meditative type of exercise that is just you hanging out in a room or sitting in a room by yourself and having some time for introspection, and do this for a while until you can kind of cultivate that feeling in other situations. So let's say you're laying and you start breathing for a moment, and you think about your breath, and there's a ton of different breathing exercises. We can elaborate on that sometime to look at that, but let's get your breathing in a good rhythm and think about how comfortable you are on the table, all of that, get to that place of ease, and then begin to imagine these situations and imagine other experiences as well. So anything that's a sensory experience that you can think of about how your body reacts to anything, whether that's ice cream and joy and happiness and fulfillment, or dread and doom and all of that. You want to try to compare these experiences and think of the wheel and the spoke that goes out to the edge of the wheel. Think about that as the experience. And there's a spoke on the other side of the wheel that goes over here, and you think about an equal or a similar experience, but on the opposite end of the spectrum. So anxiety, safety, and comfort, right? Fear of losing someone and you're anxious about it, and the contentment on the other end of being with that person and being, comfortable that you've, done everything that you wanted to do with that person in their lifetime, or whatever the case is. That you can compare all of these experiences. You can compare the pain in your left foot that you have because you smashed your toe last night on a chair or something, and the feeling of your comfortable hand, on the other side. What's the difference in those two sensations, right? And if you put yourself at the center in this hub, you're just observing, then you can think about those experiences and kind of switch back and forth between them. And you can look for those signs in your body and recognize and know what they are. So most of the time when people have a terrible social anxiety or something, I'll give them this exercise. And I'll just say, I want you to become aware of your breath and what it does when you get into that situation versus when you're calm. So become aware of your breath. Imagine this hub and the wheel. And you're going to be in the hub, and you're going to observe yourself out here like you're a third party, and you're just watching yourself have that experience, but you're going to feel it inside your own body as you're laying there. And I want you to compare those experiences. So think about your social angst situation for a moment and see what that does, and see how you can become aware of that and begin to control it before it consumes you, right? And then once you thought about that for a minute and you realize, oh yeah, it changed my breathing, it changed my heart rate, it changed my feeling of my skin. Okay, mark those sensations in your mind, and the next time you come back to that in this exercise, you'll preempt it with a little bit better breathing. Try this thing, try that thing, expect it, whatever. You can try propanolol and see if that helps. You could do any situation, but then you think about the opposite situation, and you think about the comfort of your most ideal social situation, a family gathering, people that love you and support you and all of that. What's your internal feeling of being there? And then switch back and forth between those two thoughts. Put yourself in the home comfort environment, put yourself back into the office in the social intensity environment, and try to learn to manage it by preempting the socially constraining sympathetic activating thing, preempt it by carrying over this experience of this comfort and breathing and trying to place it over top of that social experience that makes you so terribly anxious and flushed. And very often people will practice this for 2 or 3 weeks and they see a significantly noticeable difference in the way that they respond in those environments. So,
wow, that's incredible, because it is actually giving you another perspective, and it's letting you know that you actually you can observe this, because when it's happening to you, this is one of the things I've noticed with a lot of people that I've been talking to about this. And I've been doing this for about a year, talking about this and research about it. But then eventually I get to a place where I'm like, but who are we other than this? Because you know how I am. I don't want to just focus on this all the time. And it's also one of the reasons why I was nervous to continue creating a YouTube channel about it, because I didn't want it to just be the niche of like, we're a blusher. And a lot of times what I'll read stories and they're very real stories to these people. But it's very much, this is the problem, this is the problem, this is the problem. And because it can be something that has to do with a histamine intolerance, it can, I know from certain perspectives, dermatologists are saying it's rosacea. And I'm like, I don't think this is rosacea. Not my field at all, but I just definitely don't think it's rosacea. So they're treating rosacea and it's not rosacea. And then people feel even more defeated because they tried this, or it's some, for me, even when I'm comfortable, if the sun hits me a certain way, if I've had an alcoholic drink, if I'm sitting with my friends and I'm laughing so hard that my body temperature rises really fast, it's like it triggers that inside of me. And then they're like, are you okay? And I'm like, I am as safe as I could feel, but my body, if it any of that stuff, it's, oh, we're doing it. We're dying. Let's do this.
Right. So then that brings it back to that point of this is a sympathetic arousal. And once you get it triggered to a certain level, then the cascade goes and there's no way to dampen it. So how do you keep that from cascading up? And you do that by cultivating an awareness of your internal system. And I've done a lot of work on that cultivation side of things. And it's simple, but it's still kind of complex to get into it, because you're thinking about yourself a lot, and you're trying to manage things that we aren't used to trying to observe and manage. And I think that we all have a lot of work to do on that as a society, because everybody has that experience. Yet a lot of people stop shy of having that cascade that ends up affecting the skin or the head with the flushing. But most people have some level of anxiety, which is completely normal, that that triggers things and triggers them to avoid behaviors or engage in behaviors they shouldn't, or whatever the case is, or mask it or manage it or drink it away or whatever. I think that there's a lot of work that needs to be done in this personal sort of cultivation to help to lower your body's stress response and experience, that for people in this situation happens to manifest in their skin. And flushing, that's an outward sign, that's something that people can see immediately. That's got to be a whole different level of sort of self-reflection and judgment, maybe, when that happens, versus most people's anxiety just sort of stays internal and you can't quite see it.
Right.
But in your situation, that's not an expression of your anxiety. That is an expression of a sympathetic nervous system that got kicked up too high, and anxiety is just one of the things that can trip that. But being in the hot sun, trying to manage your core temperature, having a drink that kind of knocks things down a little bit, and you get overly excited, bam, that happens.
Right.
So it's not a representation. I'm sure that this experience oftentimes becomes this sort of badge or something that's shameful. And you think, well, it's me. I'm just an anxious person and my anxiety thing causes this. But I would encourage people to look at it from a different perspective and say that it's not just because that's not a sign of your anxiety necessarily, or a sign of weakness, or a sign a problem other than it looks bad to you. But anyway, the ultimate goal for every one of us is to manage our stress a little better so that it doesn't affect our system. There's many things that are caused by stress, other disorders and diseases. So we might as well have a larger conversation around all of that and figure out how we can manage better and teach people better.
So how can, and I'm sure we need to probably wrap you up here
Yep.
soon, but how can acupuncture, chiropractic care, the things that you specialize in, how can that help with the treatment of the overactive nervous system and helping get the stress out of the body?
Yeah. So everybody's heard of the vagus nerve, right? The vagus nerve is this thing that's kind of popular on the internet right now, but it is a nerve that goes from the brainstem to the lungs, to the heart, to the gut, to the liver, to everything in the abdomen. And it manages the parasympathetic side, or the rest and digest portion of the autonomic nervous system. The sympathetic nervous system forces blood places so that you can escape a dangerous situation, like a scary cat. It forces blood to your skeletal muscle and pulls it away from your viscera, which is your organs and your abdominal tissue. So in this situation, it just manifests as going into the skin as well as the muscle. But acupuncture manipulation is the only thing in research that we know of that we can come from the outside in to affect the system in a way that activates the parasympathetic nervous system. We can do certain exercises. We can do vagal nerve stimulation and other types of therapies that can prop up and make that parasympathetic nervous system stronger. But acupuncture is the only one that's been really well researched in its connections to helping to induce a raising of the parasympathetic nervous system tone, which in turn has a dampening effect, a modulating effect on the sympathetic nervous system. Sympathetic nervous system is always ready to just go to the end of the earth. Parasympathetic system is always there to kind of bring it back down and say, hey, we should probably be in a place of balance today so that I can eat this salad and digest it. And so acupuncture helps to do that in many ways, but mostly by affecting the brainstem. So the best anxiety points or sympathetic nervous system reducing points are going to be around the ears and around the scalp and around the base of the neck. Why is that? Because they all synapse in the brainstem. And the brainstem is where we release these sort of body reactions to the sympathetic activation, but it is our brain that tells the brainstem, all right, now it's time to run from the tiger, right? Because I've determined that really is a tiger and you should probably run the other way, or whatever the situation is. So acupuncture is great at doing that. Meditation, mindfulness, those things are very generic to say, but just cultivating the internal system through awareness is more accurate. And then we utilize functional neurology as a therapeutic intervention around the same time that we're doing acupuncture or chiropractic manipulation. And we're doing all of that with the intention of affecting the nervous system's, let's say, weakest areas, the things that are allowing for the symptoms to exist for whatever we're treating them for. We're treating it all the same, very similarly in most people, by addressing their particular deficit in the nervous system, which is not so different than most other people's deficits. It's just slightly different, and we treat it a slightly different way for everybody. And so we use functional neurological therapies like eye movements, and in the research they call it head-eye vestibular motion now, where we learn to manage the neck and the eye fixation and our inner ears connection to balance with all of that. So we work the eyes and the head and the neck, and then we work on the neck to make sure it's feeding back well to the brain, so that we know where we're at in space. And we do that through chiropractic manipulation or osteopathic types of manipulation. And we do some other cranial bone. So we take the skull and find the areas where it is locked up, and we help it to expand well and help it to match up with the neck, which it's sitting on top of, so that all that tension doesn't get locked into one area that can produce symptoms. I've seen cranial work alone reduce tension and anxiety like immediately, especially with the jaw pain and tension. So just combining all of those things together in a proper multimodal treatment strategy is the best thing I've ever seen when it comes to practice as a chiropractor. For my early years, in the beginning to practice acupuncture, I found more benefits with that, in addition to the manipulation and chiropractic work that we were doing early on. And now we do all of those things, manipulation and acupuncture, under the setting of a functional neurology evaluation and treatment. So there are many techniques that we utilize for that, and those are just the main ones.
Wow. Well, this is incredible. And thank you for sharing all of that, because it makes so much sense, especially when you do acupuncture on me. And I tell you, when you come back, I'm like, once my system stopped fighting the needles, I cried. I just cry. And then I go into like the best, not really sleep, but kind of sleep mode. And it's the most amazing experience. But the first few times you ever did that to me, of course, I'm super sensitive and overly aware of everything that's happening. Everything feels weird. My heart's beating fast. And then once you leave me in there for a while, sometimes, whether you forget me or not, I always feel like you do it on purpose, because you're like, she needs a little extra time to calm down. But thank you so much. And I would say, just in closing, what would you say to anybody who's watching this, who is really struggling with this blushing? Because it makes them feel shameful. I think you've said so many good points about, it's not a problem. It doesn't mean they're anxious. It doesn't mean all these different things. But what would you, if somebody was sitting in front of you and saying, this is just something terrible that I deal with, and what would be your encouraging words or advice to them?
Yeah, well, that's heavy. But first of all, while this is a problem that affects you and that you despise it probably because it affects you so much and keeps you from enjoying things, it doesn't make you more prone to having a major problem. It could be, a sign of things if it just pops up out of nowhere. But if you've left it, if you've dealt with it for a long time, then it's not an impending situation of a problem. Number one, there's nothing wrong with your brain or your mind. Number two, because lots of people in these situations think that, well, I'm just broken and forget it. I'm just going to stop messing with it and I'll just drink it away. There's not a problem with the nervous system. It is just a matter of it's reacting in a good way, a little too much. And how can you learn to manage the overall tension of the body, which you should probably do anyway, without even thinking about this problem being the thing that you need to address. This is a side effect or a side component of how your nervous system functions. And so can we do something about learning the nervous system, and can we do something about cultivating this sort of internal well-being, as opposed to constantly focusing on the external well-being? And I think that's something that we all need to do. And so if you were here in the office, I would say I'll show you how I think you can do that, but there are many resources for things like this. There's an app that I can tell you that is free, similar to, you've got the Calm apps that teach you how to meditate and all of that. That's great, but you should really learn how to meditate on your own volition without having to listen to a thing. But it's good to start, right? However, there's an app from the Veterans Association, I think, with United States military, that created an app called PTSD Coach. And you don't have to have PTSD to use it, but it has a tracker of symptoms, so you can put in whatever symptom it is. I'm anxious, or I feel bad, I have a headache today, or whatever. You can just sort of use that as your journal and kind of go into the manage symptoms portion of the app. And there's a whole slew of things that are mindfulness based. We're talking, guided imagery, positive imagery, mindfulness, muscle relaxation techniques, all of those things. While they, you get into the app and you start doing them, and you're like, well, what am I even doing this for? How is it directly helping me? Well, just, know that that's internal cultivation. So if you can let that thing guide you through all of those tools, and you just try and sample each one and give it a sincere kind of shot, then you might find something that resonates with you, and then you learn from the app, and then you learn to do it on your own, and you can just cultivate it anytime you want. Driving down the road, you can do the thing, and you can watch your mind sort of help your body to feel calmer and in a more relaxed state and not so stressed. So
awesome. That's so awesome. And that's practical. Yeah. And I will say, not only have you helped me in so many ways, just through your practice, but also you were the person, it just was a life-altering moment when you told me you are not broken. And I'm pretty sure you told me I was a little weird and you could fix me, but that's our relationship. But you said you're not broken.
Yeah, I followed that up with I'm weird too. It's okay.
You did say, and I'm weird too. Well,
we're all a little crazy.
I'll link all your information once I get this posted, and when I have the MP4 file ready, I will also share it with you so that you have it for your own purposes if you want to use it for whatever you ever want to use it for. But I will have your information in the description when I get it all ready, and it's probably going to roll out later in December or January or so. I'm doing a campaign around functional neurology and acupuncture and things like that, but this is the highlight and what everybody is leading up to. So thank you so much, Dr.
Yeah, absolutely. You're very welcome. Thank you. I like to talk, so
awesome. Well, thank you so much, and I hope you have a good weekend.
Yes, you too. Thank you.
Bye.
I really hope that was helpful for you. He is just fantastic. And I think us telling ourselves or hearing somebody tell us, you are not broken. I know we joked about it and said, you're a little weird. And he said, I'm weird too. And I don't know if you heard what he said. He said, we're all a little crazy. And just hearing that from somebody who studies the body and how the brain and the systems work inside of the body is so encouraging, because you are not broken. And so if there's anything that you walk away with today, besides all the fantastic things that he shared with you, just know that you are not broken. And I really want to encourage you to reach out to Dr. Deering if you're needing someone to talk with you through some of the things you're experiencing. Even if you're not local, he may be able to recommend somebody to you that you could go talk to. I'm not sure with COVID going on what he may charge for consultations, but I will tell you this, he is absolutely worth it. And not only does he talk with you through what's going on with your body and help you get a new perspective around it, he's also created teas and tinctures for me that have really helped to calm my nervous system. Along with other tips on sleep and looking at electronics late in the evening. There were so many things I couldn't get to in the questions because I just didn't have enough time with him, but he really can talk about gut health, diet around gut health, histamine intolerance, cortisol and other hormones in the body. We've talked about synthetic birth control, because when I came off my birth control a year ago, he was the one who helped me navigate through flushing that out of my system. What else that he could talk about? I mean, adrenal glands, fatigued adrenal glands. There's so many things that he can go on and on about that you may want to target to help calm down the overactive nervous system. But I think the walk away today Be sure to like if you want to make sure that this information gets out to other people like me and you who are looking for answers and feedback and encouragement and resources to help us navigate something that can be quite difficult, honestly.